Good morning, dear colleagues. I'm happy to meet with you one more time on Wednesday in our weekly webinars. We are coming back after a little bit vacations, and now we are going to continue our series of webinars. So, Crystal Vision Clinic in Bahrain by Professor Igor Aznauran was opened in April 2024, and now we are taking care of kids and adults in Bahrain, and we will be happy to share all our knowledge with professional specialists from all over the world. I was asked last year, one of my colleagues from Saudi Arabia sent me one of our YouTube videos and said, for example, how are you doing this low minimal invasive strabismus surgery without scissors and knives? And when I showed him a video of surgery, he was very surprised. So we are open to every one of you, and if you are interested in our technologies, we will be happy to share with you. And if you need any help for your patients, we will be happy to help with them too. So today we have a great lecture by our specialist ophthalmologist in Crystal Vision Clinic by Professor Igor Aznauran, Dr. Mohammed Ibrahim Salem. And he will talk about modern approach to glaucoma treatment. I hope you will like it. And if you will have any questions to Dr. Mohammed, please write in chat or in questions. We will answer on them after our webinar. Dr. Mohammed? Dr. Mohammed, do you hear me? I think there is some technical maybe problems with that. Oh.
Good morning, Dr. Sati.
Good day, but I don't hear you.
Do you hear me now, Dr. Sati?
Yes, now yes. Okay.
Okay. Uh, Good morning, all our doctors. I'm Dr. Mohammed Salim, and today we will have a talk on one of the interesting topics in ophthalmology about vision thief. As we all know, glaucoma and modern technologies in treating and managing this disease. So, what is glaucoma? As we know, glaucoma is a group of diseases causing optic nerve damage, which, as a result of this, affects the vision and leads to vision loss. It also has a global impact on all population all over the world, leading to cause an irreversible blindness. For example, here in Bahrain, 11% of patients who is having glaucoma, they got total bilateral blindness, and this is a high percentage. Also in Saudi Arabia, one of every 2,500 kids or newborn is having glaucoma, which is also a high percentage. So early detection and sustained management of this disease is the target and our goal now and in the future. So, what are the objectives of this presentation? First, we overview of cutting edge technologies in glaucoma care. Second, diagnostics and advancements for early detection of this disease. Third, what are the innovations in treatment and surgery? And fourth, the future directions in glaucoma management. So, diagnostic innovation, or the first and the well-known optical coherence tomography, which take cut sections into the optic nerve, the glaucoma cell layers, and also the macula, gives us a precise screening of any advancement of the disease. Second, the new star in everything now, the AI technology, which provides a pattern recognition for early detection of any of the disease. Third, the corneal hysteresis measurements also predictive for risk factors that might occur. So, drug or medical treatment is the first line of treatment in glaucoma. So there are some advancements that we have reached till now, and also improving in drug delivery. First, sustained release implants like Duesta, which is a meta an implant that we can put inside the eye, which gives a sustained release during months. This will also help the patient not to commit to a daily dose of treatment, which is one of the difficult challenges we face with glaucoma patients, actually. Also, microneedling and nanotechnology, this gives a precise delivery and reduce the side effects of the common side effects of most of anti-glaucomatous drugs. Second thing, surgery, the minimal invasive glaucoma surgery. Now we have some new stents that we use during glaucoma surgery, like eye stent and the hydrous micro stent. Both enhance trabecular outflow and hydrous. It enhance. It is put in. We put it in the Schlemm canal, and also it enhance the trabecular outflow of aqueous. Also, Zengel stent, which is a soft stent that bypasses the aqueous drainage, and also it's one of the technologies. The Omni surgical system, it's actually a combined canaloplasty with a trabeculotomy. Then that is one also of the advancements in this field. So laser, and we mostly use laser in glaucoma patients. So first, selective laser trabeculoplasty, which is targets specific cells and tells us and without any damage to other cells in the trabecula. Also, the micropulse laser therapy, it's a gentle, effective, and minimal inflammation therapy and laser to glaucoma patients. Okay, one of the challenges also related to glaucoma patient is follow-up. So if we can avoid frequent follow-ups in the clinic with glaucoma patients, it will be a great advancement in his treatment. So now there are some applications which is used on smartphones, like eye care, home tonometer, and also some apps for IOP monitoring. Those are of great benefit for glaucoma patients. And now we all of these apps for telemedicine and online consultations. It's also very helpful in these conditions. And also the wearable sensors, which it's a 24-hour monitoring with a triggerfish to monitor the IOP during the full day. So there are also some emerging therapies now on the surface for glaucoma treatment. One of them is gene therapy, which modifying genes to improve the outflow of aqueous. Also, stem cell therapy, which is focused on regenerating the damaged trabecular meshwork or optic nerve. And the third one is the neuroprotective strategies, which prevents the retinal ganglion apoptosis and increase the lifespan of the ganglion cells in the eye. Last thing is robotics and AI during surgeries. Now, robotic assisted surgery, it enhance the accuracy and the precision during any glaucoma surgery, and also AI driven planning for the surgery, also which gives us a customizing surgical approach for each patient that we can use. This was some of the modern approach during which now is on the surface for glaucoma treatment. Some of them related to the investigations, some of them related to the drug, some of them related to the surgeries, and also the future technologies that now we can develop to avoid and protect patients from getting blindness because of this difficult disease. Nice to speak to all of you, my colleagues, and see you in the next webinar, inshallah.
Thank you so much, Dr. Mohammed. It was very interesting. I think that it was your talk contains all the approach that now we have for glaucoma treatment, especially the last ones, and very interesting. And I think that they will develop in a few years very, very much about AI and robotic surgeries. So I see that there are no questions from our colleagues. I just want to uh, invite you to the next webinar that will be next Wednesday at 8 a.m. about the role of the ophthalmologist in a multidisciplinary team for treating children with neurological disorders. And the speaker will be our head and professor, Dr. Igor Aznavran. So we will send the link for this meeting. Hope you will have a good day. Thank you for all. Thank you, Dr. Mohammed.
Thank you, Dr. Sati.